Okay, so I guess what's interesting about the perspective that you bring is intensive care consultants have made certain decisions which result in people further down the line coming to you with a diagnosis or possibly without a diagnosis, and you pick it up from that point. Can you say something about the process of diagnosis and prognosis from the point at which you pick it up, and also when is that usually? How many months or years afterwards?
Okay, so the majority of patients probably come to us now within the first 2, sometimes 3 months of their injury. So they've already been in the intensive care unit, and they may come for either direct from the intensive care unit or from the neurosurgical, neurological ward before they get to us. So they're usually, on average, about 3 months down the line. And I think one of the advantages that we have in rehabilitation is that we then have the patient for quite a period of time, typically 3 to 4 months, sometimes longer than that, which allows us to evaluate them repeatedly over time, and then we're looking for a trajectory of change. So some people will remain stable in terms of their responsiveness, some may fluctuate up and down from day to day, but actually show no particular trend over time, and then some may start at a low level and gradually accrue responsiveness and signs of awareness, ranging from either the frequency of response or the sophistication of the responses, the level of responses that we see, which indicate that they may be on a pathway towards emerging from prolonged disorder of consciousness.
So this is within the first year of the event?
So this is for the initial assessment and diagnosis, yes, which would definitely be, in the most cases nowadays, within that first year. What we obviously expect, according to the guidelines now, is that patients will carry on being assessed at regular intervals. Those actual intervals may vary depending on what you're expecting, but roughly approximately 6 monthly in the first stages and potentially annually thereafter. And so what you're doing is you're reviewing them, working with whoever's looking after them, be they in a specialist nursing home or in a home environment occasionally. So you're working with family members and the care staff to identify whether there's any change in the level of responsiveness.
When patients are diagnosed as vegetative, family members often say that they believe and hope that the person will improve in a level of consciousness and develop some consciousness. How long is it reasonable to keep hoping for that?
Well, that'll depend on a number of different things. It'll depend to some extent on the type and the severity of the brain injury. It may depend on things like the condition of the patient, any premorbid conditions or comorbidities, as we call them, so other conditions that might affect their potential for recovery. Age will come into it to some extent as well, because the older the brain that's injured, the less opportunity there is for neuroplasticity and recovery by and large. So it'll depend on a number of different things. But as a rule of thumb, if you've had a severe anoxic brain injury, then the majority of patients who are going to emerge from prolonged disorder of consciousness from vegetative or minimally conscious state would probably have done so within 6 months to a year from the injury.